And our next speaker is Dr. Mei Lim, and Mae will tell us all about concerns about falling. Mae is a research fellow at Neuroscience Research Australia and also the George Institute for Global Health and a conjunct lecturer at UNSW. And her research focuses on concerns about falling and the development of digital and community-based interventions to support confidence, mobility, and independence in older adults. She leads projects creating innovative digital tools to help older people manage fall-related concerns and contributes to intergenerational research aimed at reducing frailty and improving well-being in later life. Welcome, Mae.
Oh, hi everyone. So I'm Mae Lim, so I'm a research fellow who works in the falls prevention area, and I'm especially passionate about concerns about falling, as you can see from the slides today. And I'll be sharing about current evidence and insights that maybe we can take home after today's session and for you to think about what we can do next. I'm going to start off with this story online. Where you can see that there's this older man who went to the market and he had a fall. And he couldn't get up on his own and he needed help to come up from the floor. But what impacted him wasn't the fall incident, it was the experience that he had at the market, right? The attention that he received, the embarrassment that he felt, the extra help that he needed from the people to get up from the fall. And really, this shows, and because of that, this older man chose the safest option, and that's to stay at home and not to go to the market anymore. And this could be a story that maybe you have heard of from your loved ones, like they have had a fall, they decided to just step back and to be safe and not move. But avoiding this activity is essentially doing something to our loved ones or this person that we currently are talking about. They are cutting down on their activities, they become less active, and they become more vulnerable to fall. So it's that vicious cycle that maybe many of you have heard before. Keeps jumping. Okay. So really, this story tells us that, a fall is not the end of the story, but it really brings about what's next, and that's concerns about falling. And we do know that, before I go further, I'm just going to talk about the term concerns about falling, just to bring us on the same page. You'll often hear the term fear of falling rather than concerns about falling in your practice or with people that you talk about. And we do recommend using concerns about falling instead of fear of falling, because fear is an emotional state, and it carries the psychiatric connotations and suggests more phobia, which doesn't really accurately, represent what an older adult might feel in terms of concerns. And from our conversations, when I say we, because me and Kim, we were in an international working group where we did some recommendations for the Workforce Guidelines. The recommendations, we talked to older adults, and they do prefer the term concerns over fear because it reflects more of what they are experiencing. And this is really important because if people are more comfortable with disclosing concerns as compared to fear, we are more likely to identify and address them in our daily lives, in your practice. So I'm just putting the concerns about falling definition that our colleague, Dr. Toby Elmers has defined as a lasting feeling of dread and apprehension about situations that are believed to threaten or challenge one's balance. So that's the concerns about falling definition. So again, we know concerns about falling is so common in the older population, more than 85% of our older adults might have concerns about falling at some point. This is even higher in populations who might have a clinical condition like Parkinson's, for people who have survived stroke maybe. And it is a concern that we should acknowledge. And we also know that concerns about falling is not good. It's associated with unwanted outcomes, negative outcomes, such as, having reduced mental well-being. It's closely associated. People who have concerns about falling tend to have depression as well, so it's closely related. More importantly, they change behavior. People who are concerned about falls, they might restrict their activities, like the older adult that I was talking about earlier on. Because of that fall, he might choose to stay at home and not move as much, and often become less active in their daily lives, even if their physical abilities allow them to do so. So, more importantly, in our recent work with Dr. Elmes, we did a systematic review, and we can surely say that concerns about falling actually predict falls. So it is a very important factor, and this essentially means that we can't ignore concerns about falling, and they have real consequences. So this brings me to the World Fall Guidelines, and we are going to talk about some of the recommendations that's being shared, and how there's a shift in thinking about concerns about falling, the importance of looking at concerns about falling with our older population in your practice, in our research. Now, the first recommendation is we do recommend us to evaluate concerns about falling in the holistic assessments of older adults. And we are asking clinicians to ask patients about their concerns about falling, essentially. Not just to those who have had fallen, but also those who hasn't, because we know that concerns about falling can happen to people who have fallen, or maybe they have not. And it's really important to get this comprehensive view, because it will give you important insights about what the older person is experiencing, how they interpret maybe false experiences, and how it can affect their quality of life, and how they behave or choose to behave in their daily lives. And we also recommend to combine this with like a balance and gait assessment. This will help to put the level of concern in context, and also allow you to have a more realistic appraisal of the concerns about falling that the person might have. We often talk about adaptive and maladaptive concerns about falling. So we know for adaptive concerns about falling, it means like concerns about falling can be protective. It makes someone choose to be more safe in risky situations, where they know perhaps if they need to change a light bulb, I will ask someone else who is more capable to do that. But for maladaptive concerns about falling, these people could have excessive concerns and choose not to engage in activities that might benefit them. Our next recommendation in terms of assessing concerns about falling in older adults is to use standardized instruments. And in the World Falls Guidelines, we do recommend using FPHAN or the short FPHAN in community-dwelling older people. So in a recent systematic review, there's evidence, to show that FPHAN and short FPHAN are really great tools for healthy older adults and those with health conditions that put them at a greater risk to assess their concerns about falling, because they show really good validity in terms of measuring concerns about falling in this population, in the community-dwelling older adults. So this is a concerns about falling assessment tool that maybe some of you have used in your clinical practice or might have seen it somewhere. And you could see there are cutoff points that you could refer to. It's widely used across the world. It has been translated to many languages, almost 42 and up, and also a lot of citations. So it's widely used across countries and settings. But I also want to highlight there are other tools that's equally good, such as the Icon FPHAN that's developed by Kim. It also measures concerns about falling just slightly different. We do have pictures and face scales for older adults to read the question and put the activity into context so that maybe they can conceptualize their concerns about falling better. And this tool has also been used with older adults with cognitive impairment and have shown really good validity as well. So the third recommendation for assessing concerns about falling is we do recommend using FPHAN or short FPHAN for assessing concerns about falling in hospitals and in long-term care, and I know this can be challenging. So it's a challenge because of the situation that the patient is in, or the older adult is in, or the clinicians can be too busy. But we also know that in different settings, our older adults present with different conditions. Some might have cognitive impairment, they have different functional levels. And that really set us wondering, like maybe we need a really good tool or a specific tool for the different settings instead of just using FPHAN across all. So, and because of that, we have started some work, and I'm very delighted and proud to say that our team has developed the ICON FPHAN, LTC, long-term care. So this is a tool that we co-designed with residents from residential aged care and healthcare professionals to come up with a tool that will fit the context of long-term care, where clinicians can use to assess concerns about falling. So I'm not going to go too much into detail because our wonderful colleague Leo is going to present that at our afternoon session. So please drop in to have a listen if you are really interested to find out about this too. Now the next part will be on interventions. We do have some recommendations for interventions in that World 4 guidelines. So this recommendation, we do recommend exercise and cognitive behavioral therapy and or occupational therapy as part of a multidisciplinary approach to reduce concerns about falling in community-dwelling older adults. When we recommended this, we know that the strongest evidence is for exercise intervention, especially holistic exercises like yoga, Pilates, and also being supervised by a trained professional and delivered in a community setting. We also know that cognitive behavioral therapy, where we get people to reframe their thoughts alone, or if you use it in conjunction with exercise program, so we call it multi-component program, is also effective in reducing concerns about falling. But these interventions, they tend to have short-term effects. That means the concerns about falling comes back after some time. It's just, the effects are just not as big. And then we also have occupational therapy, where we recommended to use as part of a multidisciplinary approach in community-dwelling frail older adults. So we did talk about adaptive and maladaptive concerns about falling earlier on, and in our recommendation, we also do recommend tailoring the interventions for people who present differently. So maybe for adaptive, high-risk individuals, we recommend functional, balance, and strength training and occupational therapy. While for people with maladaptive, like excessive concerns about falling, we recommend like functional, balance, and strength training program and CBT. So really, from our recommendations, we did identify some important things that we should note and do, and the research priority sits around certain things like early detection and intervention of people with maladaptive concerns about falling. And we also need to think about tailoring and trying to maximize the effects of our interventions that directly target concerns about falling. And maybe this is about combining exercise and CBT, and they might have a larger impact on concerns about falling in our older adults. Have longer-term follow-up to see whether the intervention is effective, to look at what are the active ingredients that's important to address concerns about falling, and also the need for a scalable, accessible, low-cost solution to address this. So this brings me neatly to two of our programs that we have run at Neura, where we design programs that directly target concerns about falling for older adults. And how Own Your Balance program came about really goes back to maybe when I was in my PhD days. We did a pilot study because we learned that CBT is hard to deliver in the community and it's expensive. It requires it requires therapist input, and we wonder if that's something that we could do using an online program where people just do the program by themselves. And so we did a small study where our adults participated in a pilot trial where they used My Compass, if you've heard of it before, that's developed by Black Dog, to reduce their concerns about falling and see whether this works. And from that trial, that pilot trial, we learned that it's feasible to run an online program. But we also learned that because of the program that we used in that initial trial, it's really general and we need to do something more. And that's how Own Your Balance came about. So today I'm not going to focus a lot on the methodology, but really on why, what this is about, the core ingredients, and maybe what we have learned from the program. So Own Your Balance program, when we ran the program as a trial, we wanted to evaluate whether a CBT program plus motivational interviewing, or with an added exercise program known as Standing Tall, developed by Kim, is useful to help older adults reduce concerns about falling. And so we target community-dwelling adults, there's about 200 each of them, with concerns about falling, and the approach is really this cognitive behavioral therapy program with the injection of motivational interviewing and exercise, and balance exercise. And everything is home-based and self-managed, so we wanted to answer that component of being accessible, being able to be used by many people at home. And essentially the core components of our intervention, you could see that we have our cognitive behavioral therapy strategies to help people identify and reframe unhelpful thoughts, and that's through My Compass program that's developed by Black Dog. We selected certain modules that's more relevant to concerns about falling for our older adults. We also developed a psychoeducational workbook, activity book, where we gave to all our intervention participants. Now, this workbook was developed by our team, and it really focused on concerns about falling, getting people to recognize what's concerns about falling, how to stay active, all the information that's more relevant to target that. We also have Standing Tall, which is the home-based exercise program that maybe some of you might have heard of, where we get participants to concurrently use them during their 12-week program. And the reason why we added that is because one component of cognitive behavioral therapy is exposure therapy. And we wanted our participants, or our older adults, to be able to do that in a safe way. And that means to get them to expose themselves to challenging situations, such as in their balance, in a reasonably comfortable and safe environment. And Standing Tall was perfect to do that. And last but not least, we do have telehealth motivational interviewing that we did twice throughout the 12 weeks to just talk to our participants about their personal goals, and also to set them up to have that sustained long-term engagement of physical activity even after the 12-week program. So we refer them to the New South Wales Healthy and Active and Healthy Aging website to choose a program that they would like to participate even after their 12 weeks. And in short, what did we learn? We're still preparing our results manuscript, but essentially we did not see, unfortunately, a change in concerns about falling across the groups. However, we did see improved balance confidence at 2 months for both our participant groups, where they either received just the CBT and motivational interviewing alone, or CBT with Standing Tall. More interestingly, we can see that there was sustained improvement of balance confidence at 6 and 12 months for our participants who received both CBT and the exercise component. And this is really important for us. Even though we didn't find important finding in our concerns about falling, it kind of tells us that maybe we are missing something important in our intervention, and might have to target more specific mechanisms to actually reduce concerns about falling. But I'm happy with the improvement in balance confidence though. And that nicely brings me to our next favorite program, Mindset Balancer, that our team developed. Like I just said, there are certain elements that we might be missing from CBT. And we know that for concerns about falling, it also might have a lot of emotions that's being involved in the individual. And emerging evidence have shown that higher concerns, people with higher concerns about falling, they tend to have issues regulating their emotions as well. And this is something that CBT can't really target or is not targeting, and that's why it prompted us to develop Mindset Balancer program, where we want to help people to respond to their thoughts in a right way. So essentially, Mindset Balancer program, we injected dialectical behavioral therapy principles with CBT to develop this online program for older adults to target their concerns about falling. So when I say DBT program, it's really to get people to respond to their thoughts in a way that's acceptable, to regulate their emotions, and to think about how they can change their behavior, even though the situation that they are in is not possible to change. So we recently ran a feasibility trial just to see whether this is acceptable and feasible with older adults. We ran this 10-week online program, fully remote, for older adults to do this program on their own. We did it with 30 community-dwelling older adults with moderate to high concerns about falling. And the core components, like I mentioned, it's DBT and CBT principles. This is just a snippet of what it looks like online. And it's fully self-managed, and we co-created this program with psychologists, consumers, and also experts in concerns about falling. And the topics that we included in this Mindset Balancer program include mindfulness, managing concerns about falling, positive thinking, which is still part of CBT, regulating emotions, distress tolerance, and staying active and acceptance. So really, what did we learn from our feasibility study? In general, our participants rated the program as highly acceptable, very appropriate and relevant to address their concerns about falling, and they also support the feasibility, the responses also support the feasibility and the acceptability of this self-managed approach, and that essentially means it's workable with our older adults. And we did interview our older adults just to understand their barriers and experiences for this program. I will just highlight some of the reflections that I thought was really beautiful. One of them said that it educated them. Another individual said that the program changed their mindset, which is what we wanted to do. And last but not least, the very last participant one did say that they find that they are receiving treasures from us, and these are things that's helpful, and she particularly liked the mindfulness module because it empowered her, and I think that says so much about the program and its feasibility. So really, that's just a snippet of what we have done in the last few years. We are preparing our paper, so look out for our results in detail, but really what's next? We know that concerns about falling is complex. From a research perspective, certain things, for example, the Mindset Balancer program, we need to test it out with a larger cohort of people to see whether it really works. From a practice perspective, this reinforced the need, I guess, my talk talks about the need to tailor, to integrate care, and to really think about concerns about falling for our older adults. And there's no one-size-fits-all, right? And that's really an important, I guess, thing that we have to do, that is to start asking questions about concerns about falling and using the right tool in the right setting. So I've spoken a lot today, and essentially I just want you to remember this, that addressing concerns about falling is not optional. It's central to helping older adults stay active and, what's my last slide? And reduce falls. That's it.
Thank you very much, Mae. I know we all feel very passionate about concerns about falling, and I hope it gives everyone some tools, knowing how to assess and how to ask about concerns about falling, and then also what we can do to help people to get over them. We've sadly run out of time for questions, so please join me in thanking Mae for a great talk.